Okay, thank you. I'd like to introduce Yashica Turner. I want to just thank you for just taking the time to chat with me about something that's really pressing right now, especially in these times. And that is, why don't you go ahead and just tell us a little bit about you and what you do?
Good morning. Hi, everybody. I'm Yashica. So I'm a certified mental health psychiatric nurse in the community. Um, so I work with clients who are diagnosed with mental illnesses, and we do outreach services in the community. So they need ongoing support. So that's where my job comes in. We do continuous support with these clients, medication management, crisis plan, collaborate with different healthcare workers, advocating for these clients. So I work as a case manager in the community.
Cool. When you say things like outreach, what does that mean? Do you actually physically go out into the community? How does the outreach part work?
Sometimes, so I work in the outpatient clinic. So majority of the clients, they do come in, but at times we have to go find them. Especially now with COVID, I do a lot of outreach. Well, right now we have a system in place where a specific group of us are assigned to outreach visits. Due to COVID, and of course, a lot of our clients, they don't feel safe coming out, and a lot of the homes that they live in, it's shared spaces, so a lot of them are not feeling comfortable to come out, so we go out to them
Wow.
instead to provide care.
That's quite amazing. And right now, you mentioned COVID.
Mhm.
Are you seeing an increase in the amount of folks that seek help?
Well, right now we have for our client load that we have, it's for clients that have chronic. So they have been suffering from mental disorders in a chronic state. So it's an ongoing for them. So we don't see the most that we see from our caseloads that we have is maybe increased need for support due to anxiety, depression. So they're already diagnosed with mental health illnesses, but they need that ongoing more support. So we do more phone calls. We do also like Zoom meetings with them also to give more support in these times. They will call and say, okay, I'm feeling anxious. Maybe with the news, maybe they can't go out, they're not seeing families. So of course that's affecting their mental health. Although they already have a mental illness. So of course that.
Well, I have to ask, folks that typically have no problems dealing with like they don't recognize a mental health issue,
Mhm.
and because of circumstances in their life, they start to realize that they're not able to cope as well.
Mhm.
What is the process for them? How do they reach out?
So the process is identifying. So first of all, there's a difference with mental health and mental illnesses. So it's it's a two different continuum. So you can have good mental health, poor mental health. You can have low risk of mental illnesses, and you can have higher, more serious mental illnesses. So like depression. So there's a different whole category of mental illness, different disorders.
So
So there can be mood.
where's
Go ahead.
depression in? Depression, is that a mental illness or is that just a mental health issue?
It is a mental illness. It is a mental illness, yes. So there's different personality disorders, there's mood disorders, there's psychotic disorders, there are eating disorders. So just like our physical health, we and different physical illnesses, there are different categories of mental illnesses. So we can have diabetes, hypertension, and on in mental health, you can be diagnosed with depression, you can be diagnosed with schizophrenia, you can be diagnosed with bipolar. So there are different categories of mental illnesses. Or mental health, on the other hand, is our well-being, how we feel, how we behave, how we act. So that on a daily base can fluctuate. So it's not static, or mental health isn't static, it's dynamic. It changes according to our lifestyle or daily activities or stress levels. So it changes.
So how does a an observer identify the difference between someone who's just going through you know, uh, a bout of feeling down, feeling the blues,
Stressors.
right?
Mm-hmm,
They're just
mm-hmm,
feeling the
mm-hmm,
blues,
mm-hmm,
or someone who's going through depression where
mm-hmm.
they might need some help.
So for example, for depression, it's the duration of time. So you feel so like the signs, lack of motivation, decrease in your sleep and eat. So it can be too much, eating a little, having no appetite, no interest in eating, sleeping too much, sleeping too little, giving up hope, feeling you have no hope in the future, you're giving up, you have no worth, and all those things. So if that progress to beyond 2 weeks and you feel like you're not able to pick up, or your mood isn't changing, you're going down, you're instead of improving, you are going down. So it's important for family members and friends to identify your normal behavior, so you are the one who are looking out, can see when, okay, we need some help here. Because a lot of times when clients are experience depression or having these symptoms, they're not the ones who can identify at times. So it's important for the people around you to be able to know these signs and symptoms and can say, okay, we need some help here.
Right. Wow. That's amazing. And so I guess twofold, you have the person that is feeling those symptoms and
Mm-hmm,
identifying that this is a problem, it's
mm-hmm,
going on for a long time. And those that are the observers that recognize it. How do they
mm-hmm.
reach out? Like, where do they go to get the first stage of help?
So you can reach out to your family doctor, and family doctor can make referrals. If it's something really severe and you need mental health intervention, so crisis, we have our crisis line at Coast where clients can call in, and you can visit the Emerge. There's a Psych Emerge PES also where you can get assessed. So there's different means of reaching out for help.
Awesome. So there are established channels, and the easiest one is your family doctor,
Your
right?
family
But
doctor,
if
of
you want to
course.
just pick up the phone, you don't feel like going into to
Mm-hmm,
your doctor, you can
mm-hmm.
call the Coast line.
Coast, right.
Okay.
And that's
And,
in
and
Hamilton.
and we're putting that number up on the screen right now so that
Okay.
you can see how to reach it. But
Okay.
the other thing I would ask is, if you're in that spot, or actually, here's a question for you. Do you find that a certain gender responds quicker or seeks help more, or is it just the same? It doesn't matter, male, female, doesn't matter.
Well, women more tend to speak up, to reach out, ask for help, and men, on the other hand, tends to not reach out, not seek help based on culture. Of course, they'll say, okay, or culture or can be described as men being the strong one, men being resilient, men being able to face whatever is thrown at them, and they don't seek help at times. Where with women, they might feel a bit down and they may speak to a friend or call a family member, while men sometimes tend to hold it in. Women, there are more women who are diagnosed with depression, and in men, there's more men diagnosed with drug-induced psychosis. So that's where the difference comes in with mental health disorders. But
Fascinating.
women tends to reach out more for help.
Okay, so what would you say, Yashica? Someone is looking at this and they're thinking, I or someone I know might be having a struggle right now. What would you say to them?
Reach out. So if you're feeling, again, there's difference, mental health, mental illnesses, but if you're feeling your mood is down, it's not picking up, lasting more than 2 weeks, you're not eating, you have no interest in anything, you feel demotivated, loss of hope, loss of self-worth, definitely reach out for help. Speak about your feelings. It's healthy to speak up, to talk up. If you're not having as I said, our mental health is static, it changes. So with different stressors like COVID right now is going on, we're in isolation. So for some people, they lost their jobs. So there might be financial crisis, physical crisis, several different crises. So if you're not feeling okay, it's okay to reach out for help. It's okay to pick up the phone, call somebody to say, you know what, today I'm feeling down. I need somebody to talk with. Okay. So it's important for you to identify and to reach out, ask for help. Help is there. Mental illnesses can be treated.
Wonderful.
Different
Thank you so much.
treatments.
Yeah, thank you, Yashica. Thank you so much for taking the time today. Thank you.
You're welcome. Okay. Bye bye.